Hi everybody, welcome to my channel. Please like, share, and subscribe. Today I'm going to talk about the rubber dams. Okay, rubber dams. I'm sure you all have seen these really fancy videos on Instagram, on YouTube, and TikTok about like this dentistry videos that they put with a green sheath in the patient's mouth. Well, that's just not to be fancy. It's also a protective measure. It's one of the major things that is used in endo, in restorative, in pediatrics. Basically, you can use it all the time. Oh, especially in bleaching. In teeth bleaching, it's very important also to have it. So, its purpose, it's for, again, protection. So not for the patient to swallow anything, especially during endo, because of all those needlings and everything, of the liquid. It's for the protection. It's for the isolation. It's for the making it easier both for the patient and for the doctor, especially for the doctor. It's for keeping dry field when you need it. For aseptic condition and so when placing a rubber dam, the things that you need is the rubber dam. So this is our rubber dam. You need a hole punch, which is this guy here. It's basically what we use to make punch holes into the rubber dam for the placement of where our teeth is going to be. We will need the clamp forceps, which is this clamp forceps. That's for basically, so there's these, I'll show you in the upcoming photos, that there are these little tiny holes here in the clamps that we use this clamp to spread it. So when we spread it, it will open so it can go around the tooth. We will need the clamp, of course, it's these. So the clamp, we will need the frame, which is here. That these frames usually could be metal, like this one in the photo, or it could be also plastic. So these rubber dams, again, so they can be different materials. They could be latex, or they could be non-latex. This is usually used for patients who have allergy to latex. So it's a silicone material. It could be different thickness, it could be different size, color, and texture. Here I have the thickness, so you can see that they come from thin, which is around 0.15 millimeters, to special heavy, which is 0.35 millimeters. It's just what the, let's say, dentist prefers to use. Here we come to the parts of the clamp. So this is the clamps that, as I said, this is the hole that I told you that where the clamp goes. So I'm gonna name each part of this for you guys who want to know. So number one, it's called the wings, okay? It could be central and interior, for lingual and buccally, okay? Number two, here is the bow. Remember, this always faces the throat, let's say the end of the patient's mouth. So if you're placing, let's say, on the molar, let's say this is the molar, okay, and this is the tongue, okay? So you want your bow to be here. So the bow has to be here, okay? So it has to be, so this is the uvula, let's say. These are the tonsils, okay? So it should be facing backward to the end of the throat. That's very important, remember, okay? Now number three, it's called the jaw. Number four, it's called the contact point. These little points, that's where it goes to the, it's basically the contact points with the teeth. It has to go around the teeth, see the neck of the teeth. And number five, as I said, is the clamp holes. That's where the clamp, the clamp forceps goes into those holes and expands, let's say the jaw, expands here the jaw, and let's allow it to go around the tooth. And here we have different types. Here we have these are for the interior teeth. These are for the premolars, and these are for the molars. The ones for the molars and the premolars are quite very similar. The only difference is that for the premolars it's just a bit smaller. That's normal because premolars are smaller than molars, so that makes sense. So there's different techniques to place the clamps, whatever you prefer, but I'm just gonna state it here. So the first way is that first you can put the clamp. So I'll put first choice. Doesn't mean which one I prefer or which one's the best. It's just I'm just randomly putting it. First choice, you could put the clamp first, and then the rubber dam. That's one way. There's the second choice. Put in a different color. You could put the rubber dam, and then the clamp. Usually this one you will need help of assistant is required. Then we have a third choice. You could put both clamp and rubber dam at the same time. This is what I use, and I think majority of the dentists also use this, but whatever you prefer. And for the fourth choice, go pink, is you put rubber dam with winged clamp and a frame. So this is like in one technique. Oh, sorry, I forgot to put for the frame here. So then this comes the frame, and then here comes the frame, and also here comes the frame. Basically, yeah, you have these four choices. I prefer the third choice. Fourth choice is one and all go. It's very good. It's fast, but you know, mistakes can happen always. And first choice, I think it's like the safest option. So yeah, whatever you prefer. And yeah, basically that's it. So thank you again, everybody. Thank you for watching the video. Please like and subscribe.